Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. After my second cancer treatment, I used to suffer from chronic pain, migraine, headache, fatigue before I invented ASTR's specialty. If you are Take charge of your health today by signing up for one of ASTR's free online treatment programs. Just click the link on the screen. To become a patient or to purchase ASTR tools, click the link on the screen. If you would like to become a certified ASTR provider, click the link on the screen. All right, Sarah, tell me what's going on with your left shoulder. What happened?
My left shoulder, it's it won't move, but I started feeling pain in my shoulder blade, and it just got worse and worse, and so now it won't.
You're not
I
able
can't
to
use
move
it.
it. How long has been going on?
The pain started in September a year ago, and
September, we're currently in December, almost Christmas.
it got significantly
Mhm.
worse in the summertime, around June or so. It started getting much worse.
June this year.
Yes.
Okay. So during this is a little bit over a year.
Mm-hmm.
So what kind of treatment did you have before coming here?
I had chiropractic treatment,
Okay.
and I've had MRIs on both shoulders.
Okay.
So
Did you have any other treatment?
No.
So can you tell me now how much pain from 0 to 10 and what kind of motion that aggravate your symptoms?
Probably I'm at about a constant 3. I'm always in pain,
Okay.
whether it be burning or shooting pain. Always in pain, and then this area feels like it needs to pop.
Okay.
And then as far as range of motion or what aggravates it would be showering, cooking, typing, pretty much anything. Carrying something,
Okay.
carrying a cell phone.
Mm-hmm.
If I'm in a lot of pain, carrying a
Okay.
cell phone could hurt.
Okay. So we're gonna do the motion that aggravate your symptoms. And let me know from 0 to 10 how much pain. Okay? And then
Okay.
we'll do it after the treatment. So
Okay.
let's thumb up and bring it up.
To the side?
Is that as far as you can go?
Yeah.
You're really limited.
Yeah.
Okay, let's do the front. Oh, we're barely moving. Okay, so you cannot do this.
No, I can go.
Can you bring it back?
I can go
So that's
about right
been
there.
limited for.
Since at least June. It just has gotten progressively worse.
Worse. Okay.
And on a good day, I might be able to go a little bit further, but it's not often.
It's very limited. Okay.
Yeah.
So I'm gonna take your range of motion now. We'll
Okay.
have you lie on your back. So definitely very limited range of motion. We'll have you lie on your back, hit here, and so stop when you feel pain. Okay.
Yes.
So we're gonna do thumb up, and you're gonna bring it up this way. Okay. No,
Yeah.
straight elbow. Okay. How much pain with that?
That's probably like a 3.
3.
Yeah.
Okay, you engineer. Can you remember these numbers? Okay, flexion, this is abduction, 50 degrees. 50. 50 degrees. 50 degrees abduction. Okay. I will remember them, don't worry. But it's gonna be in the test, okay? Thumb up and bring it up. So this is 85 flexion. 1 second, I'm sorry.
Should I straighten my arm more?
Yeah, make sure your elbow's straight. Sorry. Okay. I'm sorry. So that's 80 flexion. So 80 flexion and how much abduction?
50.
50. Okay. Pay attention, that's important.
I'm cheating.
50 and 80. 80 degrees. Okay, internal rotation, let's do this. Bring it here. Internal rotation is 50 degrees. External rotation, oh, okay, external rotation gonna be minus 10. She did not even get to 0, minus 10. That's the external rotation. So that's a very classic frozen shoulder. So everything should be pain-free.
Okay.
So what kind of, like, you said you had chiropractic. What did they do and for how long?
For about 6 months.
6
I've been going
months?
to him, and
Mm-hmm.
he would he would adjust the shoulder by putting his hand under here and push up and it would pop.
Okay.
And it would cause like an instant relief, but it was like temporary, it was minor.
Okay. Sorry.
Okay.
Make sure everything pain-free, okay?
Yes, yes.
And do not hit me, okay? Relax. You comfortable like that?
Yeah.
How did you hurt
that
yourself?
hurts right there.
Sorry.
I don't know, I was typing.
Did you
at work.
fall, like you fell, or like you...
I've fallen several times throughout the years.
Did you hit your shoulder, or...
That hurt.
That's very sensitive, yeah?
Yeah.
Pacemaker seizures or
Mhm.
anything?
No.
This painful here?
There's pressure.
Okay. Lift your head up. Okay, move your hair, relax. Okay, move this up here. So you said you had the MRI. What did they say?
They said that there was degeneration and that I
Okay.
had bursitis and tendonitis.
When did you have the MRI?
It was earlier this year. That's sore right there.
Sorry.
Okay.
Is that too much?
It's intense.
Make sure what I'm doing is not painful,
Okay.
okay? Because I don't want to cause
So
more
pressure, but
inflammation.
no pain, right?
Pressure is okay. Pain, that could cause more inflammation. We don't want to do that. I might start with the Magna Heal because you're sensitive to touch.
Yeah.
But see how you feel.
That hurts.
Okay. All right.
Sorry.
No, that's okay. Well, that's a sign of inflammation. So I actually gonna jump to the inflammation protocol now. If it's a mild inflammation, it should be with the magnet just a few minutes, okay?
Right.
How does feel?
That's good. That's
So
good
I'm
at all.
trying to desensitize it to see if I can go deep. So the classic frozen shoulder, limited range of motion, especially flexion, abduction, and external rotation.
Mhm.
You have all of that limited. When you look at the numbers, you will see all those range of motion are very limited.
Mm.
And usually that's happening when you not using your shoulder.
Right,
It's like disuse.
right.
It's
And
like
I tried to
different.
make sure I use it as much as possible.
Did they
so
give you
that
any
we-
exercises? Anyone give you exercises?
No.
Okay, so we're gonna go over exercises after this. Because you have not moved your shoulder for a very long time, your muscle extremely weak. If you don't use your muscle, you lose it.
Yes.
So after working on it, we'll have you do exercises. So whatever you gain here to maintain it,
Okay.
we have to strengthen. Oh, sorry.
Usually when I sleep at night, I put a pillow under this shoulder to support it because otherwise it hurts too much to sleep.
That's good, but make sure it's aligned with your chest, so
Mhm.
your shoulder is not forward like this.
Okay.
Make sure it's like
That's what causes the tightness in here.
that will cause tightness there. And when you came here, do you remember the feedback? I asked you to really. So today is your third visit
Yes.
for the shoulder. So we're gonna take the range of motion again. The original range of motion was. Do you have the original number? Oh.
For flexion?
Flexion was
Was 80.
was 80 degrees. Okay, so we're gonna do flexion again now. So bring it back. Okay. And she's not screaming. And you can see that it's 120. 120. It was 80 degrees. Just 3 sessions for frozen shoulder. Okay. So abduction was 50.
50.
Okay, we confirmed it was 50. So abduction. Okay, that was 50. Alright, so now we are exactly 90 degrees down here. 50, 90 degrees, and she's holding it, she's not screaming, you know. Okay, internal rotation was 52? It was 50?
50.
Okay, so internal rotation, and now because last time she had 50 degrees, we could not even go to 90 degrees to get the proper range of more like the measure. Now she's on 90 degrees, and look at her, she's smiling. Okay, she's not faking it. Okay, so and by the way, external rotation was -10.
Yes.
Okay, so she should be plus 90 for external rotation. Let's see the external rotation now. Can you bring it back?
Right there.
Okay, so she was -10. Now she is 5. So she gained 15 degrees. Okay? 5. You can say ooh. Okay, and internal rotation was 50 degrees. Okay? So let's bring this down. Are you trying to show off now?
No, am I doing it right?
You're doing it right.
Okay.
That was 50 degrees. Normal should be 70 to 90. And what we get now? Okay. 75.
Wait, what does that mean? What was it once before?
It was
50.
50.
50?
The normal should
Oh,
be
so it
72.
was like up here.
Yeah, so the normal should be 70 to 90.
Okay,
So you're really close. That's 75.
yeah.
Yeah. So with the frozen shoulder, you gain the flexion first, abduction second, and external rotation third. But remember, this is the third visit for frozen shoulder. You can sit up
3 days.
in 3 days.
That's pretty good, huh?
So what do you think about the treatment for, well, you had chiropractor for how long?
Years and years. And
How many times a week?
More focused in the last 6 months, 3 times a week.
3 times a week. How many months?
For 6 months.
6 months, okay.
Literally from June till now.
Okay, so you had 3 visits, ASTR treatment for the shoulder. You had 6 months chiropractor before, 3 visits a week. Wow, that's a big number. You do the math, okay?